Connections. My name is Tori Mara, and I am one of the co-founders of Outspoken Agency. And we are a speaking agency based in New York City. And we are privileged to represent wonderful speakers like Cori, who do speaking events around the world. And we have been doing this Candid conversation series for a few months now, on and off, just finding it as a way to connect our speakers with our clients, with our friends, with our communities, to engage in some thoughtful content in this time of need. So we're really excited to have you joining if it's your first time, and welcome back if you're joining again. Today, we're gonna dive into all brain and tech and health care. So we're really excited about this. We were supposed to have Cori a few weeks ago, but she had knee surgery. So we're excited to see her recovering today, and really looking forward to this conversation. So let me tell you a little bit more about Cori. She is a technology entrepreneur, engineer, and social activist. She is the CEO and co-founder of AnthroTronix. They are a biomedical research and development company in Maryland. And she's developed robots for kids with disabilities, virtual reality technology for the space station, and wearable sensors for training surgeons and soldiers. She's a global thought leader in the relationship between technology and human performance, and believes in a future of benevolent cyborgs. She's been recognized for her work on digital health software and assistive technology. She was named Technology Pioneer and a Young Global Leader by the World Economic Forum. She's also a social advocate and very actively involved in STEM educational outreach programs that empower women and minorities in science and technology. So I know there are so many other things that we could talk about with your accolades and expertise, but love to welcome you today, and we're really excited about this conversation.
Great, thank you for having me. So do you want to start with a question, or do you want me to,
Yeah, let's start with a question. Yeah, so just kind of prefacing, the topic of this conversation today, I wanted to dive into really what does human technology interaction mean to you, and why are you in this field?
Sure. Yeah, that's a great question and a great segue to expand on that great introduction that you gave me. All of the examples that you gave, I mean, I've had the honor of, over the past 20 years, running a company, AnthroTronix, HumanTech Instrumentation. And so we've really been at the forefront of the interface between humans and technology. And all of those examples that you gave, building robots for kids with disabilities, virtual reality systems to train astronauts aboard the space station, instrumented technology to help soldiers or surgeons, actually same technology, training both. All of those are great examples of our philosophy of technology, which is as enabler. Technology should enable us humans to do things that we couldn't do before we had that technology. Technology should enhance us. Mm-hmm. And I'm a techno-optimist, so I believe in the positive power of technology, which is kind of why I say, benevolent cyborgs. I mean, whether that technology is external to my body or internal to my body, like my new titanium knee, it's empowering us to be better, to think better, to do better, to act better, and do things we couldn't do before.
Amazing. And so a lot of your technology focus has been on brain health. So how did you end up deciding to focus on brain health, and why is that particularly important?
Yeah, so either indirectly or directly, I would say everything we do has to do with brain health. I mean, I'm a neuroscientist by training as well as an engineer. And, I think of the human body as an information processor. We sense information, we process it, and then we act on it. And the technology interface should help us at any point along those loops. It should help us sense the information better, it should help us process it better, or it should help us act on that information in a better way. So certainly indirectly, everything you do with a human being, I think, is related to brain health. But but in the past few years, we've really focused on how do you measure brain health. And, you know, every time you go into the doctor's office, you measure all your other vital signs, your heart rate, your blood pressure, your height, your weight. You know, we obsessively track our body mass index from the time we're born, but we have no baseline on our brain health. It's very, you know, it's been very difficult in the past to measure brain health. You have very expensive tools like an MRI or a CT scan, or very low-tech tools like, you know, a doctor putting a finger in front of your eyes to see if you have a concussion, or you know, or assuming that something's wrong if you've lost your balance, that could be something wrong with your brain. So we were asked by the military actually to help track the brain health of soldiers after they're deployed. Because as soon as a soldier is deployed, their cognitive function, their brain health changes. They all have combat fatigue and stress, especially during deployment. They're exposed to conditions that cause a blast, that could be a blast injury, that could cause a concussion. And there's a high incidence of depression and PTSD. And the problem is, even if you do a baseline test before you're deployed, that changes daily, weekly. And so the question that the military posed to us is, they said, could you develop a brain vital? And so long story short, which I'm happy to get into more if people are interested, over the span of 2 or 3 years, we actually were able to pull from the literature best practices to get at what is sort of a fundamental building block of brain health, and that's attention and processing speed. And we developed an app that was cleared by the FDA. It was actually the first cognitive assessment to be cleared by the FDA in 2014, and one of the very first mobile medical apps. And it's something that a doctor can prescribe on your phone, and it'll track your brain health over time.
So, and I know I'm familiar with other, beyond the military, other people are using this, right? You are, you have this go beyond there. Can you dive into that a little bit more?
Yeah, sure. So, you know, of course, for the military, you know, they really wanted to see if there was a change in attention and processing speed. So we really went for sensitivity, not specificity. The idea being that we wanted to very sensitively measure a change within an individual. And if there was a change, that would be a red flag to go see what else was going on. And then you need a more comprehensive clinical assessment to figure out, well, did it change because they didn't get a good night's sleep 3 nights in a row, or did they get a concussion, or, you know, what the reason is. Well, that same rationale we recognized was a clinical outcomes measure. So we actually started working with our colleagues at Johns Hopkins Hospital to use the tool is called Dana. So we were asked by our colleagues at Hopkins, if they could use Dana as a bedside assessment to look at the effects of treatment for depression. Mm-hmm. And it was such a success that they really could tell the effects of patients who had been admitted with severe depression, moderate depressive disorder, whether medication was helping, even levels of electroconvulsive shock therapy if medication had failed. And they started using it with their other patients. They started using it with their patients who had been admitted with anorexia, with incredibly low body mass indexes, and actually showing these patients at their bedside that as their body mass index improved, so did their cognition. And then, I mean, the particular doctor we were working with was so excited that he finally had a tool that he could use bedside. He actually started sending it home with the patients. So as he was treating them with different medications, he could make sure that they were maintaining their cognitive function. And actually, most recently, Hopkins has started using it in their virtual COVID clinic, because as we now know, COVID affects your central nervous system and cognition, and there's real concerns about long-term effects of COVID on cognition.
Right. Wow, that's amazing. Quick reminder, because I forgot to do it at the beginning, we would love for you to submit any questions to ask Cori throughout this conversation. We'll definitely take a chunk of time at the end, but if something makes sense to dive into in the middle of the conversation, we'll do that. There's a Q&A box on your navigation bar. There's also a chat function. So either way, you're welcome to submit your questions, and we'll try to get to as many as possible. So speaking of COVID, let's dive into that a little bit. I'm wondering if you have any information on, more about those neurological as well as mental health after effects of this illness. If you've tested positive, if you've gone through more severe symptoms, and then what kinds of new technology are emerging to treat these after effects, including the use of something like Dana.
Yeah, so definitely a few thoughts, and I'm not a clinician, so just that caveat. And also the science is changing every day. New science, but I think what's clear, at the beginning we kind of thought COVID was maybe a respiratory, a lung disease, and that's been clear that it affects the central nervous system, which is not surprising given the family of coronaviruses. So it's not surprising, but that evidence, I think, took a little bit time to come out. Certainly things like our sense of smell and taste, that's been well documented. It's been associated with strokes and seizures, and certainly slowed cognitive processes. And that's emerging as one of the concerns about the long-term effects, particularly if you've been hospitalized and then as you go home, there's definitely becoming more and more concerns about the long-term effects on your brain health. And I think tools like Dana are going to be extremely valuable in tracking what interventions work best. Is this, are lifestyle interventions enough? Getting more sleep, reducing stress, all of those things. It looks like probably not in the case of COVID, that there will have to be other interventions, and that may differ per person.
Mm-hmm.
Yeah.
A lot of what we've had to deal with COVID is obviously physical distancing. And, I have heard about people, in the beginning, not being able to have a doctor really determine that they had COVID because there were so many confusing and conflicting ideas around the symptoms and everything. So they were relying on telemedicine a lot. So we've seen a lot of emphasis on telemedicine, and I know that
Mm-hmm.
Access to telemedicine can really depend on what kind of insurance you have. So, what changes have we seen so far in telemedicine, and how will that evolve in the future? What pressures will we see to make sure that it evolves with more access?
Yeah, no, actually one of the most exciting things that has, silver linings, so to speak, that's come out of the pandemic crisis is the increase in telemedicine. Now, telemedicine has been around for decades. In fact, I think the CEO of Microsoft was recently quoted in saying that, 2 years of digital transformation was seen in 2 months. And I would argue that it's probably 2 decades of digital transformation seen in 2 months. And that was in large part because of the CMS, the Center on Medicaid and Medicare Services, allowing or changing reimbursement, expanding reimbursement. So to that point, it was actually very difficult to get reimbursed for telemedicine services. And, let's also be clear, we have a lot of room for improvement. Telemedicine right now still means video calls and phone calls, that now at least it's more accepted. Doctors are making more of an effort to do that. And we're, as consumers and patients, getting more comfortable with that. So that's, through the roof. But real telehealth, we still have a long way to go with telehealth. How do you now manage, and I think that's why this virtual clinic at COVID clinic at Hopkins is so exciting. I'm hoping that they're really going to push. What does it mean not just to do a video visit and track the patient every couple months, but really start implementing tools whether it's wearable sensors or, better data collection or apps that they can prescribe. All of that, I think, has yet to emerge. And it's a very exciting time for telemedicine, especially for those of us who've been doing it for 2 decades.
Right. Yeah. You mentioned wearable tech. So, I've been reading a lot about wearable tech that's been developed. I know there's a research center at West Virginia University affiliated with Rockefellers. I forget the full name of it, but they've been involved with some type of ring that's a wearable sensor. I've read something about a Band-Aid. There are all kinds of different ones. And I would love to hear if you know more about all these various types of wearable tech, how they're being used to scan for symptoms, how they're able to even know that that symptom is even possibly correlated with the coronavirus, and then how will this affect future of wearables, whether that's from a consumer standpoint or from a business capacity, the intersection of that with employer-employee relationships and the responsibility we're seeing. I know that's a lot thrown at you, but maybe we can dive in a little bit at a time.
Sure. Yeah, so where to start? I think like telemedicine, this is exciting time for wearables. Wearables have been around for a long time. You mentioned the ring. I think you're probably talking about the Oura ring, O-U-R-A. I have one of their early versions from probably 5 years ago. I should have worn it. I should have decked myself out with all my wearables. I do have my Apple Watch, so that counts. So again, wearables have been around. I think there's more that have come and gone than are here now, because the timing wasn't right for a lot of reasons. But even with just the things we have now, even with just my cell phone and my Apple Watch, I generate more data in a day than my doctor sees in a year. So that what I think is so powerful, certainly there's going to be more and more creative wearables. Fitbit has on many generations beyond. There's all of these wearables that have been around, and hopefully there'll be more. But the real question is, what do you do with the data?
Right.
And that's, so yes, there's privacy issues, and we can, talk more about that if folks want to, but I think those privacy issues aren't going to change, and they haven't changed. But what is changing is, what can we do with this data? Can employers use the data? Is that an appropriate use of it? There's certainly programs that employers will take some money off your healthcare costs if you do a wearable program, that sort of thing, where it's to their benefit to keep you healthy. And, I think that's appropriate, and especially if it's an opt-in. But I think, monitoring COVID patients after recovery, I think first of all, what data do we need to collect? How are we going to collect it? And then there's sort of the data mining and data analysis. And so for me, the data piece of it is almost as exciting as the actual sensing technology itself. But it is an exciting time for wearables.
So, this is a new question for me. Are we typically allowing our medical practitioners to opt into access to our wearable data, our wearable tech, and what that data is given? Is that something that people are talking about and have been against in the past? Will this be a renewed conversation?
I think I'm a little out of my depth on that. I don't know what the current conversation is. I think that we as consumers are going to be demanding to have that. We're going to have that data. And so the real question for the medical community is, are they going to meet us halfway and actually use that data? So for example, if I track my heart rate on my Apple Watch and I notice some anomalies, is that going to be relevant to my healthcare provider? Well, I hope so. I hope I'd have a relationship that they would listen to me as the patient. But the real question is, are they going to tap in? Now that's already happening. Most CPAP machines are already connected and monitored. We have we have pacemakers, we have monitors for atrial fibrillation. So we already have a lot of these, especially in cardiovascular. We already have a lot of wearables and implantables that clinicians are monitoring. So the good news is the problem's already been solved. So I think we're really looking at expanding the use cases. So I think that's going to happen probably pretty quickly.
Yeah. So with the Aura Ring or something similar with these wearable sensors that are more specific to COVID, or maybe they expand long term into identifying other illnesses or medical issues, in the past, wearable tech and these bracelets, these rings, they were a little bit expensive for the market to pay for. Do we even have access to pay for these things as consumers right now? And are they too expensive, but they are available for us to purchase? Like what's going on there, if you know any information?
Sure. Well, yeah. So cost has, there's always the early adopters, and then it becomes more prevalent. Look, the most powerful thing we have right now that almost everyone has is a smartphone.
Right.
So, I mean, you think about sleep monitoring, which, you can have a sleep monitor. There's plenty of apps that will help, do your sleep monitoring. So I do think that these type of things will be accessible in various different forms. And depending on the individual, they can decide what's a priority. I mean, there's so many of, one of the things that the pandemic has really challenged and the quarantine is it's so hard to maintain a healthy lifestyle, which is so critical for our long-term health. I mean, we know that the biggest risk factors for things like Alzheimer's are cardiovascular disease and, diabetes. And I mean, all of these chronic conditions give you a much higher incidence of Alzheimer's. There are some genetic factors, but the lifestyle factors are so critical and for all long-term health. So if you think about maintaining good sleep, low stress, exercise, eating right, keeping your brain challenged with novelty, all of those things are so critical for brain health, which is critical for long-term health. And quarantine has challenged all of that. So I guess what I'm trying to tie together is we're going to have lots of tools as consumers to figure out, how to get better sleep, how to reduce our stress, how to learn new things. All of this technology, whether it's prescribed by a doctor or just consumer available, we as individuals are going to have to figure out how do we get back to a good exercise schedule. I mean, I personally found out I love doing Zoom exercises. I did it every day for an hour. I did my before my knee surgery, I did CrossFit every day for 3 months during quarantine. I never made it to the gym every day in quarantine. So, so that was an upside. That was an upside. I mean, other things like stress and sleep schedules, all that stuff gets, So I think that all of these things are coming together in a positive way to help us.
Absolutely. We have a couple questions that have started to be submitted,
Okay.
and just to wrap back into that whole telemedicine, telehealth conversation, Troy has asked, most lay people consider telemedicine to essentially be teleconsultation. Is there a line between telemedicine and the implementation in combination of IoT and wearable sensoring, whether or not an actual medical clinician views and assesses the wearable data?
Yeah, I mean, so telemedicine, yeah, absolutely, he's absolutely right. It tends to mean teleconsultation, whether by video or phone. It doesn't necessarily mean, you could go on one side specific, like teleradiology is very specific, or telesurgery. I like the term telehealth, which is still, I mean, it's the idea that we're moving toward the healthcare system caring about our overall health and looking at all of those tools, looking at, IoT, Internet of Things. Most of our devices have some sort of connection now. Our refrigerators are going to have connections. What if we could monitor our diet, remotely. Maybe not our healthcare provider, but what if our refrigerator could give us feedback on how well we're eating and give us some tips about what we need to buy more, whatever it might be, yogurt. But I mean, and that's sort of an extreme example, but I really like the idea of tying in the Internet of Things. That's being used partially. Again, I mentioned cardiovascular disease. One sign of heart failure is increased fluid retention fairly quickly. So there's lots of scales now that have internet connections, and that could be a red flag if you gain too much weight too quickly and you're at risk for cardiovascular disease. So that's already happening. I would call that telemedicine, but I'd also call that's getting really into telehealth, which is this much broader idea of using telecommunications and IoT to really give us good health, and the healthcare system isn't necessarily in the loop.
Right. That's a great question and great answer. So I want to dive into a little bit more on brain health in terms of just what we're living in right now, physically distancing, social distancing. Do you have any recommendations for brain health, overall brain health, while we're physically distancing and we're practicing this alternative schedule, this alternative lifestyle to our life pre-pandemic, where we're doing things like CrossFit on Zoom conversations, not having parties and things of that nature?
Yeah, I alluded to it a little while ago, and I think it's worth restating. The same things that keep us healthy pre-pandemic will keep us healthy during the pandemic. That doesn't mean it's easy. That doesn't mean that it's not a challenge, but we still need the same things. We still need sleep. We still need exercise. We still need to eat right. We still need to keep our brains and thinking active. We still need to reduce stress. We still need our social interaction. So we need the same things. And that's, I think, the biggest challenge, that we're not getting them. So, that's a huge mental health challenge. I mean, we're all depressed. I mean, if we didn't, there's mental health is certainly an illness, and sometimes certainly, I mean, absolutely, there's medication and things like that, but there's also just, sort of simple depression that can be relieved by changing some of these lifestyle things. And so, certainly if you have continued depression, you should seek medical help and things like that. But I think we're all certainly a little depressed. And so I think for each person, it's a different challenge, especially if you're quarantining alone. I think that poses a whole bunch of other challenges. But I think keeping an eye on some of those key functions, like not overthinking. How can I if your sleep is disrupted? I mean, that's one of the things. If your sleep is disrupted, everything else falls apart. So really trying to figure out how to get good sleep, I think, would be my first. If you miss a good night's sleep or two, it starts to show up in your brain functioning. I mean, we all kind of know this anecdotally, where you go to bed late, you're not on your game the next day. I mean, that's measurable. If you do our Dana app, you will see your attention and processing speed has dropped based on that lack of sleep. So it is measurable. And so you are not wrong when you feel like you're off and not thinking well. So I would say sleep is number one, whatever that may take. I mean, there's a million sleep hacks out there, and I think it's different for each individual. I thought I'd share, actually, I can share my screen for a second. The World Health Organization put out a nice guide, and I can also put the link. We can add the link later, but I thought I'd share it because you'll see what I'm talking about, and then if you want to go look it up and download it yourself. The World Health Organization put this out, and you can just Google it and download it. Coping with stress during the COVID outbreak, and it just goes through pretty much what I just said. It's normal that you feel, sad, stressed, confused, scared, angry, talking to people, stay connected, maintain a healthy lifestyle, try not to use substances to deal with your emotions. I laugh because, I mean, I drank plenty of wine, a lot more wine than I might have normally, but
free time.
But yeah, and getting the facts, limiting TV. So anyway, drawing on skills. And that's actually a great one. I actually started learning the ukulele during COVID, and there's apparently that's a thing. Like there's a whole group of people who started learning the ukulele during COVID, and they're trying to come up with a cute name for it, like the Cukes or the Cubies, or I can't remember some of the other ones, but I'll probably get a t-shirt at some point. But this is something folks can, this is just something folks can look up. It's very general, but I think it's just a good reminder.
And is that, that idea of learning a new skill, that particularly helpful to your brain health, to your cognitive function?
Absolutely. I mean, I think that's something that's been really clear in the literature, that your brain needs novelty to stay healthy, and not hopefully so that the neurons keep connecting. I mean, neuroplasticity happens till the day you die. So you can learn new things, you can change the way your brain functions and sees things, and that helps keep it healthy. So learning new things, whether it's puzzles or games, but sometimes we get in the habit and it becomes too easy, so it's not new. So, learn a language, play an instrument. I mean, anything that challenges your brain. Write a book. There's lots of us, including myself, who are, decided during quarantine we'll write a book.
Yeah.
I'm hoping that'll help keep my brain healthy too.
Absolutely. You've got to make good use of this extra time that we all have. So, but no pressure, obviously. But I do like the idea of, it can be the smallest thing, like a puzzle or some kind of game app where you can just continue to excite your brain, challenge it in small ways, and continue that cognitive function that's obviously needed for your daily routine.
Yeah. Board games. Get a board game. I mean, let's get our head out of those screens and, let's learn a new board game. Change it up a bit.
Right. Absolutely. Okay. So some of us are in leadership roles, whether we are owners of business, we are in management, we have someone in a role below us in an assistant capacity. Do you have any more specific, with you yourself as a leader, any differing tips for those in these kinds of leadership roles who have had to make tough decisions, whether that's laying off employees, how to manage their workforce remotely, and other stress-inducing decisions? So these might be tips that you might have for the leader themselves, and then also how to manage their employees as well, if you have any specific guidance that you found helpful for you.
Yeah, couple different thoughts on that. I'll tell you one thing that I that kind of hit me as very interesting, that's unusual about how leaders can handle this situation. I mean, leaders have to handle crises all the time, but it's usually not crises that are affecting them directly. I mean, it may be affecting their company, so indirectly, obviously, as the leader, like whether it's a disruptive event or in an office overseas, or but it's not happening to them personally, or they might be dealing with employees who are having personal issues that they have to be responsive to. What I find so fascinating, and I'm sure someone's written about this, but I haven't really looked, is that this has been kind of the great equalizer. Not that it's affected everyone equally. I don't mean that at all. I mean, there's obviously many people are disproportionately affected, but from a leader perspective, the leader is affected as well. Right. And that's rare. And so I think that's something that they can use to their advantage in the best sense of the word, meaning that, there's always advice for the leader, like show that you're human. Well, it doesn't take much for the leader to show that this is affecting them personally, whether it's a loved one who's died, or whether it's someone who's been affected, or them personally, so all the leaders are affected. So that's a big difference. So when leaders are challenged to show they're human, a lot of them can't do it. Here they can, because they are, and they have to be. the other advice that's always given to leaders is, focus on what you can control. Well, again, we're kind of all in the same boat here. There is not a lot under our control. So focusing on what we can control, takes on a whole different meaning. And so I think keeping those things in mind as leaders address the specific situations, whether they have to do, I think it's making them more compassionate about, maybe it's not layoffs, maybe it's everyone takes, I've seen most of the examples I've seen is companies are trying to avoid layoffs by everyone taking a hit.
Right.
So I think that this has been a fascinating, and I'm sure will be written on, and maybe people will get PhDs on the topic in terms of how this has changed the culture of crisis management when the leaders are affected. So I don't know if that answers your question, but it's what I've been finding. I think the point is that the typical advice that's given to leaders has really become interpreted very differently. It's the same advice, show that you're human, focus on what you can control, be present, look at your culture, but it's taken that off the pages of a book and made it very personal to every leader.
Yeah, it's been a lot more humanizing and to be in a leadership role and really accept that you're limited in your control of the situation and to have more humility, I think. And it's obviously shown when you don't know how to do that as a leader. Your employees can really see right through that in a time like this. So that's very sound advice. Just a reminder to everybody, we can still take questions. So Q&A box or the chat box. We'd love to hear from you. I have another question for you from me. I was reading a little bit about social robots. So maybe not everybody knows what that is, but what do you know about them and how will they change this whole, going back to, we're being alone, this lack of social connection, but we still need to engage, what are social robots doing, and will we be seeing more of those more prevalent in general with the general population?
Yeah. So I love talking about social robots. One of the very first projects I did in starting my company, I started my company basically to commercialize, this was 20 years ago, to commercialize a social robot. And what did I mean? And the robot was called Cosmobot. And Cosmobot would actually work with kids with disabilities to help them with their receptive and expressive language skills wherever they were in their developmental cycle. Because what I recognized, and this was actually a funny story, we received a big center grant and we had to pick which population of folks to work with. This was when I was still a professor of biomedical engineering before I spun off the company. And we had to pick either kids, we were working with robots, and we had to pick either kids, sort of workforce accommodation in robotics, or elderly in robots. And I picked kids, and my reason was because all kids have the same developmental milestones. It doesn't matter if you're a typically developing kid, a kid with autism, a kid with cerebral palsy, they all need to reach the same developmental goals. They need to learn receptive and expressive language skills. They need to learn joint attention and social skills. So I developed a robot that would actually work with these kids where they were. If they had cerebral palsy and only had very gross motor movement, we would do Simon Says, which is a receptive language skill, a Simon Says game with very gross motor skills. Simon Says, put your hands up. And we would use whatever physical ability to train these cognitive skills. But it was very funny because when I went out for funding for the company, all the VC says, "Oh, that's so sweet. You must have a really kind heart and love kids with disabilities." Of course I do, but that wasn't why I, picked that market. I picked the market because every kid is the same. And that's not true about job accommodation and the elderly. So anyway, I have a long history with social robots. Cosmobot remained a research tool, and we've published lots of papers with Cosmobot. We didn't bring it to market except actually as a software tool. But there's been lots of social robots since then. I wrote an article actually last year in Scientific American on social robots. I'm part of the World Economic Forum's Global Futures Council on Emerging Technologies. And every year we put out with Scientific American our top 10 emerging technologies. And I actually put it out last year. So 20 years after I had done the social robot. Talk about telemedicine being slow. Social robots are even slower. But there's a lot out there. There's actually, I mean, some of my favorite social robot, which came out of the Media Lab, Jibo. You should see if you guys should Google Jibo, Jibo, and see if its video is still online, because it was such an incredible vision of what a social robot should be. It basically was a family. It was like Alexa, but with a personality, like with a body that could rotate and look at you and give you your messages and kind of interact with you and be kind of a family personal assistant. But there's more coming out, particularly in healthcare. There's some great therapeutic robots. Pero was one of the first FDA cleared robots for depression and elderly. Maybu is one that's, I believe, on the market for Alzheimer's or elder care medication reminders. So there's quite a few that are out there now, and many, many that have come and gone that were wonderful, wonderful robots that really worked on, you know, sort of the social emotional health of anywhere from kids through adults. So I'll put the link to the Scientific American article in the chat.
That'd be great. So this is beyond want it now. This is beyond Alexa and Siri. This is like in between Alexa and Siri meets Sophia the robot.
Yeah, exactly. Exactly. I mean, you know, Alexa's a great step. I mean, Alexa really is a social robot. I mean, it really is. It's a social AI. It's a social robot. But there's no agreed upon definition of robot. I should maybe have, you know, back up a bit. So most people would not call Alexa a robot, even though technically it has a sensor, it has an actuator, it has a processor. Some people feel that a robot has to be able to locomote. It has to have some sort of, you know, certain degrees of freedom, but there is no official definition of robot. So it's really a matter of personal preference, whether you want to call Alexa a robot or not. I might be a little snobby and say, no, it's an AI.
Right. Good to know, though. That's very interesting. We have a question submitted, and we haven't really touched on 5G in this conversation, but what are the harmful effects of EMF from 5G? Also, are some of the devices that claim to reduce the effects of EMF just a marketing tool?
Yeah, I mean, it's a great question that unfortunately I don't know the answer to. I'm not up on the latest science. Certainly, you know, I think science needs to drive technology, and technology can enable science. It's a bi-directional relationship, and we absolutely need to be doing that research and those studies. But I don't know what the latest research is. In terms of the devices, I mean, I would just be very careful of the claims of devices that claim to warn against it. I would look very carefully at the scientific papers that say that they can defend against it, and really look at those papers and say, did they defend against something else and they're making a step? Did they actually protect the 5G waves in the same context where you are? I mean, so the best answer I can give there is to really look at the scientific literature behind that particular product, and then see if it really does apply to your use case. And I'll give you a great example of that. There are a lot of brain health tools out there. I mean, I do this all the time. There's so many products out there that say they enhance your brain health, that are focused on the consumer now, and they claim to have this paper that proved it. Well, I'll tell you the typical brain health study that is very misleading. Let's say there's an app that says this will detect if you have Alzheimer's. Okay, so download this app, take this test, and it'll tell you if you're at risk for Alzheimer's. Well, if you look at the study behind it, what they probably did is took Alzheimer's patients and healthy people and showed that their app had a difference. That's a far cry from diagnosis, because I'm telling you, if they had taken that healthy population and any clinical population, their app probably would have told a difference. Certainly if they took a concussed patient or a depressed patient or someone who had insomnia, they're going to look different than the healthy person. So I think it's just really critical to look very critically at the science, and the science absolutely should drive the technology. That said, assuming we can do 5G safely, it's enabling, a ton of technology. I mean, it's a huge enabler for telepresence, especially thinking about the pandemic environment. What if we all had, an inactive robot in our home that we could all, using 5G, go in and possess and be present for our remote friends and partners, and help an elderly mother lift something, do different, help someone with their medication, or play a game physically. So I think 5G is actually going to really, again, assuming we can do it safely, it's going to enable a tremendous leap in what we can do with technology, particularly robotic and telepresence technology.
Very cool. We had a question submitted before we got online in the pre-registration, and Gina asked, and you kind of have touched on this, I just don't know if you have anything else you want to add in there. What do you see the major brain challenge for most Americans going forward? What can we do to address this challenge?
Yeah, no, it's a great question, and it implies that brain health is separate from everything else. And I think the first thing I would say is everything is brain health. Our ability to function at our best throughout the day is brain health, and that physical health and brain health really are one and the same. And if you think of all the chronic conditions that we're afraid of and trying to avoid, cardiovascular disease, diabetes, Alzheimer's, not only do we need to avoid them by eating right and exercising and all of those things, if we don't, they're going to affect our brains. So all of those things very much affect our cognition and our brain health. So, some things affect our cognition directly, like we get hit in the head, or our brain, we get a brain tumor, or neurons start to break down. So that is a direct effect on cognition, but the long-term effects of diabetes and cardiovascular that reduce oxygen, and things that reduce oxygen to our brain, like cardiopulmonary disorders. You don't get oxygen to your brain, it stops working. So our brain health is just so intertwined with just health. I mean, we shouldn't even call it brain health, we should call it health. So the short answer to the question really is everything. we need, and again, and I think I did answer it a few times. What does that mean? So if brain health is just health, what does that mean? That comes back to, and I don't want to be a broken record, but sleep, exercise, eating right, novelty, reducing stress, increased social interaction, all of the things we know that we need to do, and it's easier said than done, especially now.
Is there a concern that we'll have a generation of earlier onset dementia related diagnosis because of these things that are happening and this change in our lifestyles? So because you think we have a worsening lifestyle, so we'll have more Alzheimer's? I guess I'm implying that if we're stuck in this physically distanced lifestyle for, obviously we can't predict how long it's going to be, but it's going to have possibly an effect on our aging generation more severely than our younger generation to kind of reset and get back to normal. Is there any talk about that, how that could affect brain function and early onset Alzheimer's or dementia?
Yeah, so That's a good question. I don't know. I'm sure those conversations are being had. I would hope. I mean, you know, so much is reversible. I mean, you know, we're already trying to convince, we're already trying to convince we're trying to convince the generations that maybe didn't eat and exercise as much as, I mean, I don't want to say my generation, another generation, but whatever it might be. I mean, I think so much is reversible that I would really hope that we can figure out a way not to have this affect an entire generation. I mean, I don't know what science is being thought about and planned to look at that, but boy, I really hope not. And as I said, I'm not only a techno optimist, I'm an optimist. So, you know, I think if we can use this time, and I know it's so hard for so many when it's such a stressful time, but I think it is reversible. I think if we can really all pull together and pull ourselves out of this. I mean, there's so many positive, I mean, just look, you know, the revolution for this generation has emerged during a pandemic in terms of Black Lives Matter. I mean, it's been around, again, talk about decades in the making. I mean, we were talking about technology, switch to social movements. You know, this has really shone a light on those who are disproportionately affected by the pandemic, from a socioeconomic, from all different LGBTQ populations that are disproportionately affected. So I'm actually hoping that this is shedding a light. This is really shedding a light on all the dark corners of our society, and we're going to have a social revolution that's going to make the next generation, you know, just the world will be a much better place. And that's the optimist in me.
I love that perspective. That's super important for us to keep that optimistic perspective going throughout all this. It looks like we don't have any other questions, and I am tapped out on all of my questions. So I don't know if you have anything else you want to add, but this has been so insightful today.
No, thank you so much for having me. It's been a great conversation, and I love ending there. I mean, from a techno-optimist to a, you know, social optimist, you know, we have a technical revolution, a social revolution. I think that's a great place to end. So I appreciate you taking the time, and I'm grateful that everyone joined.
Absolutely. Everybody should know that Cori was protesting in a wheelchair after her knee surgery. So she is committed to her social causes. And I just want to give you an applause for doing that kind of stuff, because certainly most of us would like to be laying in bed after a surgery, but you were committed.
Absolutely. Absolutely. My first time in a march in a wheelchair, but yeah.
It was impressive.
I have to be a good role model for my kids.
Absolutely. Your children, I'm sure, were very appreciative of that and bringing them out there during that time. Well, thank you again so much for doing this. It's been very enlightening, and thanks everyone for joining. We always post these conversations online afterwards. So when you close out your Zoom, I think it gives you a link to our Candid Conversations page. You'll also get an email with a recap from registering, where it'll link to that page as well. So we'll have it there. We'll also have it on YouTube so that you're able to share the link. Feel free to have any friends, family, colleagues watch as well. We love to kind of spread the wealth of information here. We don't have any additional conversations scheduled as of now, but if you keep that page in your favorites, bookmark somehow, we'll keep updates there for you with when we have another conversation to watch and tune in for. So thanks again for now. Thank you, Cori, for joining, and I hope everybody stays healthy, safe, and happy in the meantime. Thanks for joining. Bye-bye.